Good evening. I'm Jason Johnson in for Joy Reid. Donald Trump's Operation Warp Speed or Ludicrous Speed or hyperspace, anyway, it turned out to be anything but, with only 2.1 million people initiating vaccination, meaning they received their first dose. That figure is nowhere close to the 20 million vaccinations the Trump White House promised would be administered by the end of the year.
If authorized, tens of millions of vaccine doses will be available this month.
We literally are on track to distribute tens of millions of doses of the coronavirus vaccine before the end of this month.
We expect to have enough doses to vaccinate 20 million Americans by the end of this year.
The number of doses available to us to allocate ended up being lower.
We certainly are not at the numbers that we wanted to be at the end of December.
By the end of this week, we will have distributed about 15.6 million doses to the states. By the end of next week, we'll be at about 19.9 million distributed.
How many doses you got? A lot. That last bit, about 19.9 million doses by the end of this week. Keep in mind that means doses distributed to the states. It does not mean those doses are actually going into arms. This snail's pace of a rollout is, put simply, a mess, with dozens of states saying they didn't receive the number of promised doses. We're now approaching 340,000 COVID deaths. And while the president golfed again today, the president-elect presented a remarkable, game-changing goal for his first 100 days.
I've laid out 3 challenges in our first 100 days. One of them is ensuring that 100 million shots have been administered by the end of the first 100 days. If Congress provides the funding, we'd be able to meet this incredible goal. It would take ramping up 5 to 6 times the current pace to 1 million shots a day.
Joining me now is Congresswoman Donna Shalala from Florida, who also served as Secretary of Health and Human Services in the Clinton administration, Dr. Ashish Jha, Dean of the Brown University School of Public Health, and Dr. Elaine Batchelor, CEO of Martin Luther King Jr. Community Hospital in Los Angeles. Thank you all so much for joining me this evening. Donna Shalala, I've got to ask you first, is this plan by Joe Biden feasible? With the resources and the technology that we have available today, is this rollout possible, or is he just being really optimistic right now?
He's being optimistic, but I have great faith that they're thinking through how they can ramp up the number of vaccinations. Look, in 1947, New York City inoculated 6.3 million people in less than a month. It really takes a different level of planning. You don't just send out the vaccinations. You have to have planning. And frankly, the developing world knows more about mass vaccinations than we do here in the United States because we use existing institutions. So we're going to have to go beyond existing institutions. I will feel better when Walgreens and CVS and Target and Walmart and wherever you turn, you can get a vaccination. And they shouldn't be withholding these vaccinations for the second dose. They should get everything out that they could possibly get out. But they're just not organized, and they're totally dependent on a public health system that's quite weak in terms of the distribution. You cannot depend just on the hospitals. If you saw what the public health people did in New York in 1947, they didn't depend just on the healthcare institutions. They did a real ad hoc operation to get that many vaccinations done.
With that in mind, Dr. Batchelor, there was a tweet by Dr. Nguyen today. Nguyen did a great deal of detail about what the rate would have to be for vaccinations in order for the United States to reach any sort of herd immunity or put this under control. At our current rate, it would take 10 years in order to get this country over the hump with COVID. How fast do you think it's realistic for us to be maybe in 6 months from now if there's not a tremendous amount of pushback for Joe Biden's plans?
Well, I'm hoping that President-elect Biden will be able to implement a plan to get the vaccine out to our communities as quickly as possible. As a hospital, we are actively engaged right now in vaccinating our staff. So we have currently vaccinated over 1,000 members of our staff. I've had a vaccine myself. We are focused on educating the community next and making sure that people understand that the vaccine is safe and effective and the way for us all to protect ourselves, our communities, and to end the pandemic.
Dr. Jha, so while we're beginning this sort of slow process under this current administration of rolling out the first dose of the vaccine, we've also now been struck in this country by our first case of the new strain of coronavirus. It's been found in Colorado. The biggest question on everybody's mind, first off, does this current vaccine, can it stop this new strain of the virus? And two, if it can't stop this new strain of the virus, what kinds of changes might we need to take at sort of the chemical level or the pharmaceutical level in order to be prepared for these kinds of changes?
Yeah, so great questions. And again, thanks for having me on tonight. Look, here's the bottom line. This strain, the UK strain that we've been talking about for a couple of weeks, it was detected in somebody in Colorado who has not been traveling. So that means that this person picked it up in Colorado from somebody else. Which means that this strain is here, has been in the U.S. probably for some time, but we're not monitoring for this, and that's one of the reasons we haven't identified it until now. One of the things we got to do as a country is start monitoring for these things. I mean, it's really stunning that other countries are monitoring more than we are. On the issue of vaccines, I actually do think that the current vaccine is likely to work. Not 100% sure, none of us are, but I think those studies need to be done, and they're being done right now. Imagine that terrible outcome where a variant becomes resistant to the vaccine. And I think it's not likely. I think it's unlikely. But look, this is not, a lot of unlikely stuff has happened in this pandemic. Probably about 6 weeks before a new vaccine could be generated that would allow us to target that new variant. I don't know whether it would have to go through all the FDA testing in the same way. There's a lot of unanswered questions. But in the short run, I'm pretty confident that the vaccine is going to do really well by us.
Donna, what we're hearing also right now, as these vaccines are being rolled out, is that Hill staffers will be getting vaccinated, those people who are working close to members of Congress, which seems more or less like a good idea. What we don't know is whether or not they're going to be providing vaccinations for security, for the maintenance crew, for the other people who are working in and out of the Russell Building, in and out of the White House. Do you think that every single person should be covered when we're talking about these sort of government agencies? And if so, does there need to be a priority on maintenance workers and security over staffers, or should it just be everybody first come, first serve?
Yeah, absolutely. There has to be a priority on them. The same in hospitals. The people that clean hospitals are as important as the first responders that we've all been talking about. Everyone that has any kind of contact or whose work has contact with a patient ought to be immunized. So, but look, we've got lots of vaccine. It ought not to be sitting in refrigerators. We've got to get it out, and we've got to get it out quickly. And we have to use new distribution methods to get it out. If New York City can get that many people immunized in a relatively short period of time, we certainly can get big numbers in this country. 1 million a day would be lovely. 1 million a month would be lovely. But look, we can do better. We certainly can do better. And the rest of the world has all these immunization days in which they inoculate hundreds of thousands of people. I was in India when they did that, and it takes an extraordinary organizational effort, and we need to get that done, as opposed to doing what this administration has continued to do. Just delegate it to the states and let them figure it out. That's not good enough when you have to get millions of people immunized as quickly as possible.
And it's even worse when you still have members of Congress who may be getting vaccinations but still want to walk around maskless. That becomes part of the issue as well. I want to go back to you, Dr. Batchelor. You talked about taking first doses and connecting people. One of the things that we've had a lot of trouble with in America is track and trace. People don't want to answer surveys that come through email. So they definitely don't go along with track and trace. What needs to be implemented on the ground to make sure that people come back for a second dose? One of the things that has always been a concern of mine is that somebody will come in and get dose number 1, and maybe they're too busy. They don't come back for dose number 2. How do we make sure that follow-up process works when we can't even do track and trace?
So when we give the vaccine, we ask a number of questions about the patient and potential risks. We give them a little card that shows that they've had the vaccine and when they're due for the second dose. and we enter their name into a public health database so that we can remind them to get their second dose. That's part of the process that we are using to vaccinate folks. I also wanted to comment on your previous question about who we vaccinate and who we give priority to. So we know that healthcare workers are in the first group that's getting priority for the vaccine. At our hospital, that means everyone who works with patients was given the same access and the same priority to the vaccine, from the people who transport patients and clean rooms to the doctors, nurses, and respiratory therapists. And we're proud that all of our staff are stepping up and taking advantage of the opportunity to get the vaccine. As we heard, the vaccine isn't going to help us unless people take it. It's not vaccines that end pandemics, it's vaccinations.
It's people. And
yes.
With that in mind, Dr. Jha, what happens if I don't assume this is going to happen at many healthcare centers, right? But let's imagine it's a government agency. Let's imagine it's a public school system. What happens when you start running into people who say, I don't want to take it? Whether they claim it's religious reasons, whether they think they're about to be microchipped. What do you think needs to be both the public health and possibly the government response to people who will inevitably say they don't want to take the COVID vaccine?
Yeah, so I think this is going to be a real issue. And in my mind, there are two or three things that need to happen. I mean, first of all, there are people who have just concerns because we've built this vaccine pretty fast and they want to know that it's really safe. I think those people, what you do is you engage with them, you communicate with them, you understand their concerns and you address them. And you do it using community leaders and religious leaders and local public health leaders. So you need a strategy there. There are a small proportion of people who are just pretty hardcore anti-vaccines that we may not be able to get everybody and we may not be able to get, and we don't need to get everybody. I don't see any major role for government mandates. What I think is going to drive high levels of adoption is they're going to watch people get vaccinated and do well and be protected. And then I think a lot of private companies are going to require it for their employees. I can imagine airlines requiring it if you want to get on a long-haul airplane. And so people are going to have to make choices. You want to get vaccinated and be able to fly, or do you not? And of course, it's America. If you choose not to, that's okay. But I think a vast majority of Americans will end up wanting to get vaccinated, especially given how safe and effective these vaccines are.
And I want to close real quick with this. It comes to safety. This is the thing that always occurs to me. And it spins out of my last question about security. Donna, what happens if there's resistance, even armed resistance, to, say, a mobile truck coming in to vaccinate people? We've seen anti-maskers. Look, we've seen people attempt to kidnap governors and break into government buildings because they don't like being told about a mask. How are these elements going to respond to white trucks and vans coming into their community saying, hey, it's time to get your vaccination? Is there a plan in place? What kinds of plans need to be put in place to make this rollout safe for those delivering?
Well, first of all, the local police departments are thinking this through so that I have some confidence in local law enforcement. Let me say to the previous questions, too, going back for a second shot is not new in this country. We do it for kids all the time. We have tracking systems. If you have a baby, you know that you have to bring them back 3 or 4 times so that they get all of their shots. So there's nothing new about this. And second, I believe economic incentives are going to drive the acceptance of vaccines. Business leaders are going to say to their employees, we can't open unless you're vaccinated.
Right.
We need everybody to get vaccinated. We can't open schools until everyone's vaccinated. So I'm a great believer, not necessarily that we have to do mandates, but that employers in this country and school leaders have to say, you want to reopen the economy, then we all have to get vaccinated. That's a very different kind of argument added to the scientific.
I hope you are giving me some optimism here. I hope that the market and schools are enough to make people move. Thank you, Congresswoman Donna Shalala, Dr. Ashish Jha, and Dr. Elaine Batchelor. Up next on the readout, Republican leaders do not want struggling Americans to get $2,000 relief checks. Democrats are for it. Trump is for it. But Mitch McConnell is doing everything he can to stop it. plus the impact that fight is having on the Georgia Senate runoffs, now just 1 week away. Stacey Abrams will join me. And when Congress counts the electoral votes next week, will Mike Pence side with Trump or with the Constitution? Back with more of the readout after this.
New projects means new project managers. You need to hire.
I need Indeed.
Indeed you do. The moment you sponsor a job on Indeed, you get a short list of quality